Hey guys, just wanted to get the diet PowerPoints out lecture out to you. So here we go, healthy diet for a well client. Ideal body weight. This is just where we want our patients to be based on their height and how much their intake should be and keeping their weight stable. BMI is the body mass index. This is what determines whether a person's weight is okay for their height. It kind of helps to assess for malnutrition, especially overnutrition and undernutrition. Um, it's more of a reliable indicator of a person's weight rather than the ideal body weight and the stepping on a scale and those types of things. BMIs are classified in um, five, five levels. So underweight is anything under 18.5%. Normal weight is 18.5 to 24.9. Overweight is 25 to 29.9. Obese is anywhere from 30 to 39.9. And extreme obesity or morbid obesity is anything over 40. So as you can see up on the top, I have the BMI equals the weight in pounds divided by the height in inches times itself. And then if you take that equation and multiply it by 703, you'll get the BMI. Ananda diagnosis generally is imbalanced nutrition, more than body requirements, less than body requirements, depending on where they're sitting with their BMI. Okay, so what factors affect nutrition? The development, where the person is, where our patient is in their development. For example, when when they're infants and when they're adolescents, they have these huge growth spurts. So they're going to be eating everything in sight and trying to get as many nutrients as possible. The sex of the patient. Males are going to need higher calories, higher or more protein, where women need more iron. Culture and ethnicity is really going to affect nutrition because it's going to determine food preferences. So overall, the guidelines for healthy nutrition through all cultures is to eat moderately to maintain your body weight and eat a wide variety of foods to meet all these nutritional requirements. So they're getting enough nutrients, minerals, vitamins, those types of things. So getting into the different cultures, the African American culture, they view food as gifts, and this should not be rejected. If somebody offers you some type of food or treat or whatever, if you turn it down, they're going to feel bad. They look at being overweight as a positive thing because their diets are generally high in fat, cholesterol, and sodium. Arabs, they use lots of spices and herbs when they're making their meals. They have some type of bread at every meal. They don't eat any pork. Food is eaten with the right hand because the left hand is used for other, going to the bathroom and wiping. Because the right hand is clean, the left hand is dirty. And they drink all their drinks at the end of the meal, not during or in between. Chinese, the foods are served in a specific order. A lot of traditional Chinese do not use ice in their drinks. Different foods are chosen so that yin and yang can be balanced. They feel like this really helps with the heartburn, with the indigestion. They use soy sauce instead of salt. Oh, sorry. And each region has their own traditional diet. Jewish, they don't eat pork either. All the blood is drained from the meats. Always wash their hands before eating. There's different laws that govern how animals are killed, prepped, and how people eat them. And then meat and animal milk are never eaten at the same time or at the same meal. Mexican rice, beans, tortillas, staple foods. They also view the larger body size as positive. The main meal for Mexican is the noon meal. Their foods are chosen as hot and cold theory. If somebody has a cold illness, they'll eat hot foods, and if somebody has a hot illness, they'll eat cold foods, and it'll balance it out. Fruit drinks, sweet fruit drinks are very common in the Mexican culture. Navajo, there's ceremonies and rites of passage are always celebrated with food. Thanksgiving. Herbs are more medicinal, rather to treat illnesses instead of flavor their foods. Their major source of meat is sheep, and their most common vegetables are squash and corn. So, beliefs about food. How many of you heard these wonderful diets that everybody's talking about? I don't remember. I don't even know some of them that I've heard my daughters talk about, but a cleansing diet was one of them, and a juice diet or something. But just a fad. It's a short-lived thing that people feel like really works. I'm not a diet person, so I really don't know much about the diets that are going around. I know there's that paleo diet. I know gluten-free diets have become more popular than just for caring for somebody who's gluten intolerant. People feel like that's a good way to lose weight. Yeah, those types of things, just fads. These just come out of TV, magazines, just different media that people get the idea. South Beach diet, that was one that was a big one for a while. Maybe I'm dating myself, but personal preference will affect nutrition. If someone doesn't like veggies, they're not going to eat veggies. So they won't meet that nutritional need. Religious factors, the practices will also affect nutrition. Roman Catholics don't eat meat during Lent. Protestants, they don't eat or drink meat, tea, coffee, or alcohol. Orthodox Judaism and Islam prohibit pork, and Orthodox Jews have our kosher customs. And up here in the Wisconsin, our religious is to eat fish on Fridays. I don't expect you to know all those. Just know that the religion affects the person's nutrition. Lifestyle. Nutrition might be linked to certain lifestyles. As you can see here, I have 3 pictures of gas station foods. The ones on the left and in the middle, people generally grab because they're in a hurry. The one on the right is my friend Krista, who's down. I think she's in Paris now. God only knows where she ends up. But she's from Florida, or she's from my area, and she moved down to Florida. And she actually started a line of healthy foods for gas stations, convenience stores, so that people had healthy stuff on the go. Economics, types of food and the amounts and the quality of food really depends on a person's economic status, if they can afford it. If you've seen, you can get a hamburger for $1, but you can't get fruits for under $6. Medications affect nutrition. and they might alter the taste or decrease their appetite. Grapefruits actually decrease absorption rates um, for certain meds. So just know that different foods, different nutrients can decrease their appetite, change their um, taste, how they view it, and the absorption may be changed. Health kind of affects nutrition if someone has dysphagia, um, or if you're sick with the flu, you're really not taking in the proper nutrients. Alcoholics, they have a need for increased calories. They may have a lot of nutritional deficiencies. They don't have an appetite. Their intestinal mucosa is damaged, so what they do take in does not get absorbed appropriately. Their vitamin B increases just to make up for the amount of alcohol coming into the body so that the body can metabolize that alcohol. But alcohol can be good in moderation. Advertising, um, commercials, and billboards and stuff are strategically placed during different TV shows, during different areas, so that it attracts people to the restaurant or the fast food chain. Psychological factors can be anorexia, bulimia, or it can be stress eating where they eat when they get stressed out. All right, let me just grab a drink here. All right. So, infants, neonates to 1 year, all of their nutritional values are met with either breast milk or formula. Uh, some babies are kept on like a 3 or 4 hour diet, but others are kept on a demand feeding. So basically, that baby's fed when they're hungry and no set schedule. SIDS is a risk a lot of times after eating when the babies lay down or they lay them on their belly. They may have a problem with SIDS. So teach our parents that after baby eats, make sure we're laying them on their back so that they're not at such a high risk for SIDS. Regurgitation is just basically they're spitting up after formula or breast milk during the first year. And when babies are about 4 to 6 months old, that's when parents should really start introducing solid foods. Sometimes when they get this age, the milk is not getting enough to keep them full. But we want them to be able to sit up well, with or without support. We want them to hold a spoon. They need to be able to kind of chew. The tongue movement back and forth that they did to suck on the bottle, that's not quite as pronounced. They will still, that's how they will mash their food, but it won't be as pronounced. They will learn how to deal with the texture and swallow of foods, and they're able to turn away when they're full. So we want to make sure that they can do things like that before we start having parents introduce solid foods to them. Should we start with cereals like rice or grain cereal, then up to fruits and veggies, and then move on to strained meats. Honey should actually be held off until they can actually build up some flora in their belly. Honey can actually cause what's called Clostridium botulinum, and under a year, these infants can't fight it off, so they can actually die if they get infant botulism if they're given honey. It sounds like a very simple, easy food that would help, maybe spice up their foods if they didn't like them or whatever. But it is not a plan to be giving to anybody under the age of 1. Bottom mouth syndrome. As you can see the picture on the bottom left, these babies' teeth are all decayed because they've had milk or juice sitting in their mouth. Like if they lay down for bed and they have the bottle propped, that juice or that milk will be sitting on their teeth and actually cause them to rot. Early childhood caries is just the um, cavities. These teeth are lost, they're decayed, or they're filled. Uh, we just need to teach the parents to not prop a bottle, and when they take their babies to bed, encourage them to drink water or use a pacifier rather than going to bed with a bottle of milk. All right. Toddler. Um, Toddlers will start to really adjust to breakfast, lunch, and dinner. Sorry, I'm eating Italian ice too. My teeth are cold. But they're still going to need help with their glasses, with their cups. Toddlers actually go through what's called something called physiological anorexia. um, and they'll really look like they're not eating a whole lot. It's just because from their growth demands from infancy, when they start entering the toddler age, their demands will really, really slow down. So if you look at a day or two, they won't look like they're eating anything. But have the parents look at it over like a week time frame. They might actually learn how to, or they might actually prefer to have eating rituals as a toddler. And maybe they eat their foods in a certain order. Who knows what their little plans are. And because of this physiologic anorexia, they are at risk for fluid imbalance, um, dehydration. So just make sure that we're teaching parents if they do see this anorexia that we encourage them to have their favorite drinks sitting out around in the house in sippy cups. Table foods, they need vitamin C, vitamin A, calcium. Biggest thing on this slide is not to use food to reward a kid or as a punishment if they don't eat. Preschoolers, they're eating adult type foods. They're going to be very active at this age. So between the breakfast, lunch, and dinner, they're going to need snacks in the morning, snacks in the afternoon. And a lot of times they're just going to rush through their meals and then go back to playing. They like to help out in the kitchen, um, but they still need assistance with cutting their meat or pouring their juice or using certain utensils. Their growth is slow and steady. These kids may actually, where the toddler went through the anorexia, the preschooler is going to go through food jigs where they only eat certain foods for a longer period of time. My son growing up for the longest time, probably like a year, actually, the only thing he would eat is oatmeal. And he still eats it quite frequently, but he eats other things now. So rather than just looking at a day or two of what they're eating, because you're going to say, I don't know how they're getting any of their nutrients in a day or two, teach parents to look at food over 2 weeks. Because what they can do is during these times where they're just wanting oatmeal, you can slide a yogurt up next to the oatmeal, see if they'll eat some of that. Or, another food that they like. So maybe they'll eat all of their yogurt and have a couple bites of whatever else you have them offer. School age kids, they're going to eat their breakfast, lunch, dinner, generally a snack or two. These are the kids that really need a good breakfast, a high protein breakfast, because they're really getting into school and it's physically demanding and it's mentally demanding. So they really need to have a good breakfast before they head off to school. Um, School age kids, this is where they see the undernourished kids most frequently. They're tired easily and they get infections easily. Obesity is common in this age group. Um, I say a lot of it is because of video games and um, those types of things, or phones. I know phones are a huge thing in my house, and I think every day I threaten to bust the phones against the wall. And my husband tells me I can't. Um, so basically, treatment for this school age group that's overweight, we want to try and help them decrease their weight gain, um, and teach them that it's okay to gain weight, but in slow increments. And sometimes counseling may be helpful. Maybe they've learned how to stress eat. Maybe they're 10 years old and every time they get worked up, they eat. Teenagers have really active lives, and so their eating patterns really kind of suck. They need more protein, more calcium, more vitamin D, more iron, more B vitamins, um, and they should actually have up to a quart of milk a day. So their intake can actually be quite high. On average, the adolescent requires 2,000 calories per day, um, but they might need more. Boys in sports might need up to 3,000 calories a day, but if they're in more than one sport and they're constantly going, they might actually need more than 3,000 calories a day. Problem is that McDonald's, Subway, all these fast food chains are really easy for our kids to just, I gotta grab something to eat, so I'm gonna go through the drive-thru. Just easy, quick, but it's not healthy for them. Problems with our adolescents. Um, Obviously, there's obesity, um, anorexia nervosa, where um, they're not able to or they refuse to eat. It's characterized by rapid weight loss. Basically, these people are basically skin and bones. They look emaciated and they still feel like they're fat. I took care of a young lady who had anorexia nervosa, and I was, I don't know, 140 pounds, maybe a little bit smaller. I don't know. And she was like 70 or 80. We were about the same height. And she looked at me and told me I was skinny, but when she looked in the mirror, she felt she was fat. So it's really kind of how they feel that they look, not what anybody else looks like, because her perception was completely off. I was a good 50, 60 pounds more than her, where I was skinny, but she was fat. Bulimia, these are when people are binge eating, and then either vomit whatever they eat or use a great deal of laxatives to get rid of all of the food that they put in their belly. Childhood hunger. Um, Kids really need to have a sense of food security where they're having access to food at all times. Um, Helps keep them active, helps keep them secure. Um, Food insecurity is when these kids are not able to have or consume adequate amounts of food. Um, my friend Nicole, when she was first removed from her home, um, she went into foster care with one of my friends. Um, actually would hide food because she never knew when she was going to get it again, because of all the abuse she went through. Um, she always had access to food at her foster home, um, but because she was so used to guarding and hiding her food, that's what she continued to do for months. A big cause of hunger in children is poverty. They can't afford food. Sorry if I talk too much. My throat gets dry, so I have something drinking. Um, kids are becoming more overweight, more obese. These are the kids that are above the 95th percentile on that growth chart. Like I said before, kids and teens are less active than they were previous years. Um, a lot of times they're out playing video games or sitting watching TV or playing on their phone. um, so basically, what we need to do as nurses identify these kids, teach kids before they become overweight, and support the families into learning how to adapt these healthy lifestyles. Maybe they need to get out and go for a walk as a family so that their little guy down here on the left can lose a little bit of weight. Um, maybe they need to have different types of diet, so they're not eating at McDonald's or whatever, or the portion size, just so that families can understand that they need to adopt healthier lifestyle for the kiddos. One other thing we can do is teach parents to limit screen time to 2 hours or less per day. um, make sure that these kids get actually 30 to 60 minutes of exercise a day. They can use a the My Plate as a food guide. Really discourage those fast foods. I know even my youngest, she's picked up some of my terrible eating habits, and I'm not a fan of McDonald's, but she sure likes the McDonald's chicken nuggets, and she's learned that um, if we're having a very busy day, we'll just stop at McDonald's, Mom. Oh yeah, I know that's a really bad thing to get into, but we all do it. But then also helping parents learn how to offer healthy snacks, maybe cutting or washing the grapes and putting the serving size in a baggie and leaving it in the fridge. That might be helpful to the kids. They like to grab and go, so if it's handy, they may eat it. All right. Young adults, women in this group need a high intake of iron, at least 18 milligrams per day. Otherwise, they are at risk for anemia due to um, their period and their food intake. So we can teach them to eat iron-rich foods, liver, kidneys, eggs, fish, chicken, green leafy vegetables, dried fruits, and then also vitamin C. So teach them to eat an orange because that will help with the body to absorb the iron. Females also need vitamin D and calcium. Um, and obesity, this is the group where people gain weight. They're tiny during um, the teenage years, but metabolism slows down or they're more sedentary. They're not as active as they were in high school, so they start gaining weight. Middle age, continue to encourage them to have a healthy diet. They still need the increased protein and calcium. Um, teach them to have a decreased cholesterol and to drink 2 to 3 liters of water a day. Females in this age group are generally postmenopausal, so they're at a high risk of osteoporosis. So we can really teach them to have, intake vitamin D and calcium, whether they're drinking milk or whether they're taking a pill as a supplement. So this age group is also at risk for heart disease, so we want to just encourage the vitamins A, C, and E. Middle age, again, they may have weight gain, same reasons. Their metabolism is slowing down, their activity is slowing down. Um, they don't need as many calories, but they may not actually reduce them. They just continue what they're used to eating. But this is a problem because, especially in this age group, and if they are overweight, they are at high risk for diabetes and hypertension and arthritis and mobility issues. All of the factors that can worsen and cause other safety issues. Middle-aged people might report more heartburn and belching, just because um, they don't have as much gastric juice and free acid. Older adults, um, same dietary, but need a decrease in calories. They're not as active because they're maybe less mobile. They just don't have the energy that they need to. that they don't use the energy that they would use to burn the calories. Higher amount of carbs um, and fiber for bulk. Issues with eating might be caused because they have tooth loss or dysphagia, or maybe they don't smell or taste as well anymore, so they don't want to eat as well. Alright, so those are all nutritional variations through each of the um, lifespans. On to standards for a healthy diet. These are very all common sense. The guidelines are rewritten every 5 years, but they want an increase in plant foods, decreased added sugar, solid fats, increased physical activity, um, meet the nutritional needs, decrease fat intake, consume less than 1,500 milligrams of sodium per day, and drink alcohol in moderation. Now, some of these really depend on the person, whereas my daughter needs to consume at least 3,000 milligrams of sodium per day, otherwise she's in trouble. So these are just generalized healthy people. Healthy People 2020, their goal is to reduce obese adults and obese children. Um, they want to increase the number of people 2 years and older that consume less than 2,300 milligrams of sodium a day. Now, like I just said, certain people need to have an intake of at least, Bailey needs at least 3,000 milligrams. And there's been days where we have put 20,000 milligrams of sodium into her body to try and get her to feel better. Um, so it just really kind of depends on the person. Watching the weight gain. And Healthy People 2020 wants to help reduce the amount of calories that people are taking in from solid fats. Each goal has a target percentage rate that they consider reaching their goal. Alright, food guide pyramid. This thing used to be I don't know if there's an old one. Yep, right here. It used to be set up as a pyramid like that. Now it is set up from the bottom up because they wanted to add physical activity. They wanted to add this little guy here. These are the food guide, the My Plate. This is all as a guide, not a definite, because you don't want some little old lady to be eating the same amount of foods as a 18-year-old kid. So it just helps people aid in making their decisions, their daily food decisions. My Plate, Michelle Obama introduced this in 2011. Again, this is one that's used as a guide, but not as a definite. it will kind of shows people how to get close to their guidelines. It'll need to be personalized for every person. Like I told you, the little old lady is not gonna eat the same amount as an 18-year-old kid. She might eat like a bird and he might eat like a hog. So you can see here that you can just kind of um, see the portion size. Food labels is our next thing. I think that we're getting close to the end here. Food labels, anything that is prepared in a box, in a bag, needs to have a food label on it. So that consumers can read the packaging to determine how much is in each of the items. So we'll go through each section of the food label. So the first section, the green section here, is just the serving size and number of servings in the container. Most of the dietary values are based on a single serving, but sometimes, like here, there's 2 cups in the entire package, but a serving size is only 1 cup. So they'll say their serving size per container is 2, but all of these are based on the 1 cup of the serving size. Calories and calories from fat, which is here. This is based on the 2,000 calorie diet. Number 3, the fat, the cholesterol, the sodium. Sorry, I'm kind of flipping all around. These are all nutrients that should be minimized. It's got the percentage right here so that you can see how much you've met for your day. So if it has 470 milligrams, that's meeting 20% of the total intake of sodium a day. So if you eat something else that has 40%, you've met 60% of your sodium intake for the day. Number 4, list nutrients that are commonly deficient, their fibers, their vitamins, minerals. Right down here, these bottom ones, it's vitamin A, vitamin C, calcium, iron. Depending on what the food is. I'll add that up. They should reach a level of, they should reach 100% throughout the day. And then the footnote. Is anything down here? I hope you can see my little mouse. I forgot to check that. But basically the daily value for fat, cholesterol, sodium, carbs, fiber, and they could break it up for a 2,000 calorie diet and a 2,500 calorie diet. Alright. So altered nutrition. Malnutrition is just a lack of necessary food substances. It includes undernutrition and overnutrition. So undernutrition is the amount of nutrients that a person is taking in is not meeting their daily requirements because they're not taking in enough. Overnutrition, they're taking in more than what they need, more than their daily energy requirements. And this energy is getting stored and built up in their adipose tissue. So like we said before, the BMI for overweight is anywhere between 25 and 29. Obese is 30 to 39, and then morbidly obese is anything over 40. How do we know that someone is malnourished? This one is for the inadequate nutrition. They're not taking in enough. They're going to have this weight loss. They're going to be overly weak. They don't have enough oomph to really do much. They're fatigued. They're lethargic. They're not going to be able to function as well. They're not going to be able to do their ADLs. Wound healing is really going to be slowed because, well, we'll get into that in a little bit, but wound healing actually requires protein. So when you're deficient in protein, your wounds aren't healing as well. They're gonna have more infections than the norm if they're not adequately nourished because their immune system isn't working as well. Respiratory function is going to be decreased. They're going to be in the hospital longer. Their hair is going to be brittle. Their skin's going to be dry. And their muscles are going to be flaccid. So this is kind of what I was talking about when I was going to start talking about the protein. But when a person is malnourished, the carbohydrates that are saved up and stored as glycogen, they'll be used. But these can only be used for about the first 24 hours. Once these 24 hours are up and all the glycogen is used up, the body's actually going to be using the protein that's been stored to help, do wound healing, for example. So protein is one of the main labs that can be drawn to determine if a person is undernourished. Yeah, proteins. I'm trying to figure out how I want to word it. Albumin really shows more of an acute malnourishment. Nutritional assessments. There are so many out there. Just done in various settings. Could be by a nurse, could be a dietitian. Really identifies the patient that's at risk for malnutrition. I actually watched a student a couple weeks ago determine that a patient was at risk and referred her to a dietitian all on her own. I was pretty proud. So what's going to be in a nutritional assessment? There's going to be a nursing history. So we're going to include their diet, what might affect their food intake. Maybe they're vegetarian or maybe they're a pescatarian. Just kind of depends on what they feel, their beliefs. Skin fold measurements, mid-arm circumference or mid-arm muscle area. These are all invasive techniques that's going to be done to measure fat stores. A lot of times BMI will also be done. Biochemical data, this just means blood work pretty much. Lab tests are going to be done to look for deficiencies. Like I said, albumin is the most common protein that's looked at to determine if somebody is undernourished. And I said that wrong. A low albumin level is a long-term undernourished. This just basically tells us that this person has been malnourished for a very long time. It's a long-standing issue. Transferrin is the acute, right now, lab that will tell us that this is a new issue. Could be total iron binding. Prealbumin. This is another rapid acting one that will respond quickly when something occurs. Normal levels are 15 to 35. Anything below 15, the person is at risk. And anything below 11, this person really needs an immediate intervention. I had a guy who was living at home in a wheelchair. He was by himself. He had some massive venous stasis wounds. Yeah, they were extremely deep. I mean, the guy was 6'8" and 400 pounds. But he had these massive wounds on his legs. And when I drew a prealbumin level on him, it was like, I want to say it was 8. And people couldn't figure out why his legs weren't healing. They're scrubbing him with bleach water, which is also called Dickens. It is a thing. And his prealbumin level was so low but there's no way he would have been able to heal. Total a white count is going to be done so that they can look at the immune system, see what it's doing. Because remember, somebody who's malnourished, their immune system is not going to be working as well. Physical exam, really focus on tissues that will show problems with nutrition, their hair, their skin, their eyes, their nails, and their mucosa. So their general appearance, they're going to be lethargic, they're going to be fatigued, they're going to be apathetic, just kind of, which reminds me, I will tell you guys, please answer the question. I did do a survey, and it asked a yes or no answer of do you know what apathy means? Because it has to do with the test. Their weight, they may be overweight or underweight. Their skin dry, flaky, scaly. There isn't going to be any sub-Q fat. Nails are brittle, pale, ridged, might be a little spoon-shaped. Their hair is dry, it's dull. It might be thin, it could be brittle and breaking. Their eyes, their conjunctiva might be pale or bright red. If these people are experiencing a vitamin A deficiency, they might have more problems with night blindness. And their lips are going to be swollen, red, cracked, and there's going to be fissures. Their tongue, remember this will be swollen, beefy red, and it won't have the bumpy appearance of the taste buds on there. The gums are going to be swollen, inflamed, they're going to bleed easy. Muscles are going to appear wasted, they're going to be soft, flaccid. GI system, they're going to have anorexia, they're going to complain of heartburn, diarrhea, constipation, and that belly is going to look like a toddler, like their belly when their belly was protruding as a kiddo. You're going to see that. If you've ever seen those commercials on TV that talk about adopting a child and feeding them, all their little bellies are just protruding and huge. The nervous system, their reflexes are going to be decreased. They're not going to be able to respond as quick. They're going to have kind of like a neuropathy of their hands and feet. They might be irritable. They might be confused, actually, because they're not getting enough nutrients to keep that brain up and running. Dietary data, well, they'll look at their person's usual eating patterns, their food preferences, the allergies, how much they usually type, and any religious or cultural factors. They might do what's called a 24-hour food recall. So basically the person has to go back for the past 24 hours and write down everything they ate and try and remember how much. And then they take that and compare it to the food guide to determine if there was enough nutrients in it. Food frequency record. They don't have to write down everything they ate, but it really has them watch and check how often they eat vegetables or how often they eat grains. Just kind of keeps an eye on their intake. So these are just kind of a couple different dietary intake sheets. They're also going to get a food diary. Somebody may keep it going while, like, as they're eating or just as they finish, write down everything they ate, their portion sizes, and what they ate. Diet history. The dietitian is actually going to take care of this one. They're going to interview the patient and include all of the dietary assessments. So, food safety. And my goodness, we are just about done with this one. There are a lot of people that get foodborne illnesses such as salmonella, whether the food was not cooked properly or it wasn't prepared properly. So what I really just want you to take away from this slide is these 4 safety measures. Make sure that when you're you're talking to your patient about food safety, that you're really encouraging them to wash their hands and wash their surfaces frequently. You don't want to be cutting chicken and not wash your hands and go do something else because you'll spread the salmonella. which leads us to teaching our patients not to cross-contaminate the food. Don't cut the chicken on the board and then go back and cut the celery or the potatoes for soup on the same board without washing it. Make sure the meats and all the other things are cooked to the proper temperature, that it's not raw or too cold inside. And anything that's left over, make sure it gets put in the fridge promptly. If it gets frozen, make sure it gets put in the fridge to thaw out and use immediately once it's thawed. Don't let it sit and become room temperature because then you'd have to throw it out. So here's just a nice little poster. Cook to proper temperatures. Do not cross-contaminate. Wash hands and out surfaces often. And refrigerate promptly. And that's it. Alright guys, I hope this helps. I wanted to get these out yet this week so you have a few extra days to look at them. If you have any questions, let me know. I think the big thing this week is the health promotion plan. My email is kind of going crazy and I'm wondering if it doesn't have something to do with some of those. So if you have questions on this stuff or anything else, let me know. Alright, we will talk to you guys later.